Hi guys, my name's Adriana and thank you for joining me today. We are going to be talking about our second part in our series of nutrition for cardiovascular health. If you didn't go see my last video, I highly recommend. I kind of break down the fats into saturated, unsaturated, trans fat. I only scrape the surface. However, if you do want to do a deeper dive on any of these topics, I highly recommend, as this is only basic information. Today we're going to be talking about dietary fiber, soluble and insoluble. So those are the two types of fiber that we can get in our daily diet. Sorry about that. The first thing we're going to talk about is soluble fiber. So this is fiber that dissolves in water and any other body fluids. This also assists in feeding good gut health, reduces the body's ability to absorb fat, also reduces those LDLs. Like I talked in my previous videos, LDLs are that bad cholesterol and something that we don't want to go higher, we want them to go lower. Another good thing is blood glucose. I think this is in every type of fiber. The benefits of lowering blood glucose is those who do have a lower risk of type 2 diabetes. So that's something to keep in mind, especially throughout all nutrition. Another factor is it lowers the risk of cardiac disease and relieves constipation. Most of these soluble fibers are found in avocado. I love a good avocado and I always eat an avocado. Sweet potatoes, apples, bananas, asparagus, berries, and carrots. So that's just an easy breakdown of some soluble fibers. Another topic that we're going to be talking about is insoluble fiber. So this is fiber that doesn't dissolve in water. It absorbs fluid and sticks to other material to form stool. This then assists in improving the waste process, allowing softer, bulkier, and regular stool. Also improves bowel health. So if your stool is regular, then your bowel's regular. So it's healthy. And also prevents and treats constipation. It decreases the risk of heart disease and diverticulitis. Most of these are found in beans, nuts, whole wheat flour, and veggies. And something to keep in mind when it comes to fiber, soluble or insoluble, we don't want to take it all at once. We want to kind of ease our way into fiber, because if we take all of our dietary recommendations or guidelines all at once, then we have a higher risk of increasing our inflammation and causing abdominal pain, and something that we are trying to avoid when we're eating fiber. Another thing to keep in mind is usually when it comes to fiber, we can't just like pick and choose on what fibers we're eating. It's kind of just in most of the foods that we're eating in general. So we get a good recommendation or a good amount of each type of fiber when we are eating these types of foods specifically. Some dietary guidelines or general dietary guidelines. For men is about 38 grams per day of fiber. Women is 25 grams per day of fiber, and then there's like a general guideline of 14 grams for every 1,000 calories per day. That's supposed to have another zero. Anyways, so that's something just to keep in mind. Here's just a basic overview of fiber and what it benefits when it comes to cardiovascular health and the risk of heart disease. Something to always keep in mind: don't eat it all at once or your tummy will hurt. But I appreciate you guys, and I hope you guys enjoyed, and have a great day.